Okay, we're going to have a look at the hip joint itself and the approach that you'd use for an injection. I'm using just non-sterile gel here to start. I've got a curvilinear probe, it gives us more depth. This is the 5-1. I've got the little point on the ultrasound probe here corresponding to the left side of the screen. And we're in a position where we're going to come up just adjacent to the groin. And in the middle of the screen, you're going to see a double kind of crescent, the kind of semicircle, bright light area. And then above it, it's kind of wearing a little bit of a hat. The space between is actually the femoroacetabular joint itself. When I'm in this position, we're also, we can scan across here and see where the artery is by putting some color on it. You can always check that. In this position, I'm going to rotate at basically 90 degrees and get that very sharp image of the head and neck junction. So at the very bottom of the screen, you've got the femur, and then you can see that there's a contour just kind of coming up to the right side of the screen where the head and neck junction would be. You actually see the acetabulum just above that, and the joint capsule is going to lie kind of on top of the acetabulum, extending down on top of the femoral neck, and we're going to aim for the spot between the femoral head and neck junction. You want to make sure you have a clear path for the injection so that the needle doesn't go adjacent or close to any major vessels. We are going to have to go through some of the muscles themselves. As we come down, the needle path is going to be kind of from top left down to bottom right. And we're using a 3.5-inch spinal needle to do this procedure. Like I said, you put color on just to see that you have a free path void of any major vessels and extending down there. In fact, if I come a little bit anteriorly, we're probably going to be able to see, and maybe I'll put on the color actually, and we'll take a look and see if we can see that artery. So you can see the artery right there, pulsating in the middle of the screen. So of course, you can come a little bit laterally, avoid that space. Of course, your image is slightly degraded while you have that color Doppler on, but you take that off, measure off on here, avoid that major vessel, have a path that's clear, and inject.